Hey everyone, Dr. BBT here, and today we're going to talk about almost everything you need to know before your breast augmentation surgery with implants. There's a lot of information out there, and my job is to make you feel empowered before you even call. There are a few considerations you should think about, whether it's with me or any other plastic surgeon, and so we're going to go over in this video the most commonly asked questions like what size is right for me, whether it's go above or below the muscle, saline or silicone implants, and more. One of the most commonly asked questions during a breast augmentation consult is, what size am I going to be? Well, that largely depends on your size, your frame, your breast proportions, and your measurements. One person's C cup might be another person's D cup, and so I cannot guarantee exactly cup sizes, especially since different bra brands have different sizing. Therefore, I individualize every approach to every patient. And the other thing is, it depends on what you want to be. Do you want to be on the larger end or do you want to be on the smaller side? Being in New York, patients often want a natural, subtle look where people don't really know if you have an implant or not. Whereas patients from Florida and Texas often want to be bigger and have an augmented look. There is also a limit to how large you can be, and that depends on your skin quality, and also your measurements. To see if you are a candidate for a large or small implant, you have to come in for measurements and a preoperative consult, and where we examine your skin and take measurements to individualize each approach. Another very big question I get often is whether I should get silicone or saline implants. Both are safe and both are effective means for augmentation. The FDA approves silicone implants for patients 22 years and older, whereas saline implants is FDA approved for 18 and older. The reason why only 22-year-olds and older are FDA approved for silicone is because the original studies only included patients 22 years and older. One of the benefits of silicone implants is that it looks and feels more natural than saline implants. Saline implants sometimes have more of a rippling or wrinkling effect that is noticeable through the skin. So one of the benefits of silicone is that not only does it look more natural, but it also feels more natural. When it comes to implant rupture, saline and silicone implants greatly differ. For example, if a saline implant ruptures, it's basically just salt water, and your body naturally reabsorbs it without any issues. What you will notice is that one side is flat, the side that's deflated and ruptured, and the other side, if it's intact, remains augmented. So having a rupture is fairly obvious. Silicone, on the other hand, if it does rupture, it's commonly referred to as a silent rupture because you cannot see, you cannot feel or examine any changes to the breast after a silicone implant rupture. Oftentimes people wonder, is that safe? Is that okay? Well, nowadays with 5th generation implants and higher, the gummy bear technology prevents the silicone from leaking all over the place. And so if you squeeze a ruptured implant, it will come out temporarily, but then it will go back in. And so it won't be disseminated throughout your body. It won't be flowing all over the place. That's why it's important to surveil and check your implants for rupture every so often. The FDA recommends having either an MRI or a high-resolution ultrasound, which we can do here in the office, every 5 to 6 years after original implant surgery, and then 2 to 3 years thereafter. Deciding whether to have saline or silicone implants is a deeply personal decision, and oftentimes I leave that decision up to the patient. However, I'll always go over the pros and cons of each and let the patient decide. In my practice, most of my patients prefer silicone implants for the reasons we just talked about, but ultimately the decision is yours. Another very important question that comes up a lot is whether the implant should go above or below the muscle. This is a crucial question that partly depends on your body type, your skin type, and how much breast tissue you have to begin with. There are pros and cons to each. For example, if you go above the muscle, you won't have any movement of the implant when moving your arms or your chest, mainly because the movement from your pectoralis major muscle will move the implant and sometimes can shift the implant. This is known as animation deformity. If this happens over a long period of time, it can lead to implant malposition where the implant is low and off to the side. A benefit of going under the muscle is that you have a little bit more natural look and you reduce the rippling and the wrinkling that you see from implants. If you take a look at this implant, when I hold it up, you can see these lines that are kind of wrinkling over the implant. That sometimes can be more visible in patients who have their implants above the muscle, more prominently in patients with very thin skin or very little breast tissue to help camouflage it. So the less breast tissue you have, the less you have draping over the implant, and thus you'll see more wrinkling and rippling. Another very common question I get is, what's the lifespan of a breast implant? Well, I always tell my patients breast implants are not lifetime devices. And what I mean by that is that you're not meant to keep them in forever. I tell my patients when you sign up for breast implant surgery, you're really signing up for at least 2 surgeries, one to put them in and at least one more to either remove or replace them. It's important to check your implants for rupture every so often. Like I mentioned earlier, the FDA recommends checking your implants for rupture 5 to 6 years after the implant was placed with either an MRI or an ultrasound, and then every 2 to 3 years thereafter. If your implants are intact and there's no issue, you're not having any pains or any deformities, you may not need to remove your implants or replace them. Generally speaking, implants last about 10 years, but if you're at 10 years and you're checking your implants and there's no issues, you might not need a surgery to remove or replace them. If, however, your implants are fine and your breasts are starting to sag, or you want to be a bigger size, or you want to lift in a bigger size or downsize, then that might be an indication to remove or replace your implants. It all depends on what you prefer in terms of sizing and if your breasts are sagging over time. Nowadays, with higher generation breast implants, like 5th generation implants and higher, the integrity of the capsule of the shell of the implant is a lot stronger and therefore more durable. The risk of rupture has decreased over the years, and nowadays implants can last a little bit longer than they used to. Generally speaking, like I said, 10 years is about the time that it's ready for an implant change. But if, again, no implant rupture, whether on MRI or ultrasound, you can leave them in for a little bit longer. Another question I get all the time is whether or not I need a lift at the same time of my breast implant surgery. The short answer is it depends. If you have a lot of skin or sagging breast tissue, you might be a candidate for a breast lift at the same time of an implant surgery. If you're a borderline candidate, meaning you may or may not need a lift at the same time, it kind of depends on what your goals are and what you want to look like after surgery. This is a little bit of a harder situation to assess preoperatively, but having an honest discussion with your plastic surgeon, depending on how big you want to be and how much upper pull fullness you want, meaning how much cleavage you want not only in the middle but also in the upper part of your chest, is crucial in determining if you're a candidate for that or not. Sometimes patients ask if they can have other plastic surgery done at the same time as their breast implant surgery, and the answer is yes. Oftentimes we can combine a breast augmentation surgery with implants with a tummy tuck, and that's sometimes referred to as a mommy makeover. You can also have liposuction, arm lift, or any facial procedures done at the same time. I will say, however, after 2 or 3 procedures, the length of surgery becomes a risk factor for certain complications, including bleeding, blood clots, and things like that. So depending on how many procedures you want, it should be safe and effective way to get what you want. But I will say after a certain point, it might be too much surgery at once. Another consideration is recovery after surgery. And if you have too many areas operated on at once, recovering at 3 or more areas at the same time might be too much for you. This all depends on how you tolerate pain and how much surgery you can tolerate and recover for after surgery. Now, these are some questions that patients don't often ask, but I always talk about during my consultation, just so I can help patients understand the different types of implants and shapes and sizes that exist. We generally use smooth implants that are round, meaning the height and the width of the implant are the same. If you take a look at this implant here, it's equal in terms of its size, both up and down and side to side. That's a round implant. One other dimension that isn't talked about enough is the projection, basically how forward the implant is. So if you look at how the implant's going to look inside the body, the projection is basically how forward the implant's going to be, and that can be a very powerful and dramatic change to someone's chest. Now, depending on your size in terms of your measurements, you may not be able to accommodate a very wide implant. And so if you want to have a very large size, the way we have to accommodate for that is to increase the projection or pick an implant that's very forward projecting. Depending on what your goals are, this is an important consideration to talk about with your plastic surgeon, because this is somewhat limited to your measurements, but also in terms of your size, that depends on how much projection we give you. There's only so much width we can go, because if we do too much, the implant's going to be spilling out to your side into your armpit, which we don't want. That's why it's important to really give an idea of what you really want with your plastic surgeon when talking about sizing. So now we're going to talk about what to expect at your initial consultation. During the first consult, I like to get to know my patients. I like to get to know their history, any medications or allergies, Also specifically related to breast surgery, if you've ever had any breast surgery, breast biopsies, any pertinent mammogram or ultrasounds done to the breast are all crucial for me to understand before surgery. An examination is critical to any consult I see, and detailed measurements are going to be taken. This not only includes the dimensions of your breast and chest, but also your nipple and your areola and how it relates to your chest wall. After examination, we'll take photographs and we'll go over sizing. Sometimes we can use a 3D imaging system to simulate your results with different sizes and shapes of implants. Other times we can use physical implants and put it in your bra and see how it looks like in real life in the mirror together. Either way, we go over the sizing together and make sure we're on the same page. We often order a range of implants for surgery, so don't worry. We have everything within range of what we talk about, and we have different dimensions, size, and projections like we talked about before. After sizing, we go over the risks, the benefits, and alternatives to implant surgery. This is known as the informed consent process. Basically, we will go over a long, comprehensive checklist of all the benefits, all the alternatives, and all the risks of surgery. You'll have ample time to ask questions, and this is your opportunity to ask any and every question you have, not only about breast implants, but breast implant surgery and what to expect after surgery. So what can you expect after surgery? Well, the recovery for breast implant surgery is fairly straightforward. You'll be a little sore for a few days, and if the implant is placed under the muscle, you might be sore for up to a week. Most patients return to their desk job within a week. You'll be given medications, and you'll be directed how to take them after surgery. Most patients feel like initially the breast implants are very high on the chest. That's normal. It will take weeks and sometimes up to a couple of months or more for the implants to drop and fluff and assume its natural position. It will look very high at first, but don't be alarmed. That's, again, very natural. You can shower 24 hours after surgery and you'll be put in a surgical bra. You can use a sports bra instead of the surgical bra, but do not wear a bra that has an underwire for at least 4 weeks, as that can interfere with the healing of the incision. In terms of activity and exercise, you can resume light activities at 2 weeks and more rigorous high impact activities at 4 weeks. This is important so that you reduce the risk of bleeding or implant malposition, especially if the implant is under the muscle. Doing too much or doing too many activities with your arms may move the implants before the capsule around the implant is formed. So that's a comprehensive list of things to consider before your first breast augmentation surgery. Obviously, that did not include everything. I tried to make it as brief and understandable as possible. If you have any questions, comment below or call us at our office at 212-223-8300.